taken is to avoid a lot of interpersonal contact when you come back in off the field, and also do everything you can to make hand hygiene possible, ideally with water and soap, but if that's not available, an alcohol-based hand cleaner.
So we're hearing a lot in the news about shortages of supplies, and rural providers and hospitals, clinics, FQHCs often have even more of a shortage in terms of workforce, but also actual supplies that are needed. Could you speak to more rural specific suggestions?
Yes, and I think toilet paper is in short supply everywhere, urban or rural. But the issue of shortages of critical supplies such as medications, as personal protective equipment for healthcare settings, and particularly for our FHQCs, the FQHCs, the federally qualified health centers, is an area of concern. So this is where the national response, I think, is going to be very helpful in terms of the work that's going on at FEMA in partnership with HHS, Department of Health and Human Services, to be able to look at alternative supply chains to get some of that personal protective equipment out, and also working with HRSA to be able to do everything we can to support the FQHCs to not only have supplies, but also be able to manage the potential increase in patients, as well as apply good infection control practices, particularly when PPE may come into short supply. CDC's particular role in terms of PPE is addressing the demand side of the equation. What are the things that we can do to help preserve PPE? We've got a couple of tools online that I think can be useful to clinics and hospitals, whether they're rural or urban, to be able to assess the PPE burn rate and be able to project what their needs are going to be down the road. The response through the Assistant Secretary for Preparedness and Response is focused more on the supply side and ways to supplement what's available, including being able to provide what provisions are available through the Strategic National Stockpile.
Great, thank you. What should rural hospitals and clinics be doing to prepare for a surge?
Yeah, so preparedness is a very important part of all this now that we're actually in response mode. Almost all hospitals have done some type of pandemic influenza planning exercise, and they actually have a plan that is written out. Of course, they say plans are no good if they just sit on the shelf. So I hope everybody who is running these hospitals has had a chance to pull down their plans and think about what they learned during pre-pandemic tabletop exercises, and then how they'll deal with some of the unique aspects of this particular pandemic. Some of those unique aspects include healthcare workers who are unable to come to work because of school closures and lack of child care for their families. And then, of course, the concern that healthcare workers themselves can become ill. And not only do we want to make sure that healthcare workers are healthy and able to keep working, but also that they don't then become a mode of transmission to higher risk patients.
Great, thank you. How can we tell the difference between flu, COVID-19, and allergies? Because it is allergy season in a lot of areas.
Yeah. There's a lot of overlap. So let me start with that. And of course, with COVID-19, it's a brand new disease, so we're still learning a lot about it. Flu and COVID-19 probably have the most overlap because fever, cough, muscle ache, headache can be prominent parts of both. Allergies generally don't cause fever, but I have also talked to a number of patients who had very little fever with COVID-19, or it wasn't the first symptom. So it's, I think, virtually impossible to anybody who walks in the door complaining of a runny nose to say for sure that which is allergy, which is influenza, which is COVID-19, but we continue to learn more about it. I know there's some reports now about things like altered sense of smell or a funny taste in the mouth being more common with COVID-19. I think at this point in time, those are really anecdotal reports, and they're intriguing and certainly merit more study, but we have no idea how predictive those type of symptoms might be for COVID-19.
Great, thank you. Since we're more rural and spread out, are we at less risk?
That's a very good question, and it depends on more your local environment than your, say, your county environment. So if you're in a county with only 2 people per every square mile, that's a good start. But if you're in a household that has, say, 20 people in it, your risk may be similar to what it might be in a more urban area. I think in general, we will see slower entry into particularly the frontier areas because of lower volumes of traffic. But it's important to look at history and what we've learned from that. When we consider the flu pandemic of 1918, before we even had air travel, that was an infection that spread far and wide. And by November of 1918, after the virus first was fairly prominent on the east coast of the United States in September, it had spread even as far as the Seward Peninsula in far western Alaska. So I think it's reasonable to assume that while the entry into rural areas may be lower and it may be easier to do some social distancing because of the lower population, we shouldn't assume that any part of the country is going to be spared.
Great, thank you. Do we think this will go away during the summer or during warmer temperatures?
Well, the question about seasonality is one that I think we always, we would like to think that it's going to go away, but it's important that we can hope for the best, but we have to be prepared for the worst. It gets back to our opening discussion about this is a brand new disease and virus. And while most respiratory viruses are less common in the summer, we don't know just how this one will behave.
Great, thank you. So for rural providers, should they be keeping well child appointments, physicals, those kinds of things?
So the decision of keeping I'll call them elective visits, really depends on the local situation. And it's concerning because we know that there are women who are pregnant now, they are still going to deliver. We know there are people with high blood pressure who still need to have their blood pressure checked. We know there are people with diabetes who still need to have their diabetes managed. And we know also that we want to keep our kids healthy. So being able to have those well child checks and get on-time immunizations is critically important. So it really is a decision that ultimately will be decided locally. Just very broadly, our recommendation from the CDC is to consider deferring non-emergent procedures or elective surgeries or visits to the provider. But just when to do that depends on the local situation. Because we don't want to do things so early that then things that aren't emergent become emergent by the time we're seeing a lot of spread of the virus locally.
Thank you. How should providers, hospitals, and clinics respond if patients call suspecting exposure or reporting symptoms?
Well, first of all, that's what you want to have happen, is have people call ahead rather than show up and maybe sit in the waiting room for a little while and then come back and say they've been coughing and have fever, and particularly if they've been around someone known to have COVID-19. So that call ahead is important for clinics and hospitals. Need to have a plan for how will you assess those people, and also make a determination of whether or not they need to come in at all. There is a tool available that CDC has provided online that allows someone to check their symptoms and determine whether or not it's important that they get in to see a provider right away. But of course, someone who's severely ill, short of breath, chest pain, blueness of the lips, these are symptoms of potentially a very serious condition, which might be COVID-19. That's the situation where a phone call is nice, but the phone call that needs to be made is really to 911.
Thank you. There's some questions about language clarification around isolation versus quarantine. What does it mean to self-isolate versus self-quarantine? And what should people be doing and not doing when they either self-isolate or self-quarantine?
Okay. Well, let's start with the definitions. And I know this is confusing because many people use these terms interchangeably, and they actually have technical meanings, and there's a reason why they're different words. Quarantine means you're removing people who've been exposed to an infection from those who have not been exposed. So both groups are not ill. Isolation is when you have someone who is known to be infected and you're separating them from people who are not known to be infected. So usually in the hospital, that's very common, whether it be actually an infectious disease or even just something that is grown out in culture. Quarantine is much less common. In fact, the COVID-19 outbreak is the first time there have been federal quarantine orders signed in over 50 years. So we really are in a very unusual situation. In terms of some do's and don'ts, I think the do's is as much as possible.
Good afternoon. I'm Dina Diorio, Mecklenburg County Manager. I'm joined today by Gibby Harris, our Public Health Director, Robert Graham, who runs our Emergency Operations Center and Emergency Management, as well as Deputy Chief Estes from Charlotte-Mecklenburg Police Department. Earlier this week, UNC Charlotte, was identified as a location for a mass care facility. Yesterday, I received a request from Gene Woods of Atrium Health and Carl Armato from Novant Health to assist in standing up a facility to provide additional 3,000 beds above and beyond hospital capacity. This is directly related to medical surge data that we received from Atrium and Novant. And in summary, and I think we're going to put this slide up on the screen for you now, but in summary, with no social distancing, on April 25th, we would reach our medical surge. We would have 8,905 people hospitalized, 3,288 people in the ICU, and 1,603 people on ventilators. If we assume social distancing, we would reach our peak on May 11th. We would have 4,692 people hospitalized, 1,742 people in ICU, and 845 people on ventilators. That is why social distancing is so important. If we practice social distancing, we can really help facilitate flattening that curve. But knowing that, we know that our peak will be somewhere between mid-April and mid-May, regardless of how much social distancing we do at this point. And the need for those 3,000 beds appears pretty likely. So the planning for that is underway. We have a team at the EOC that is helping to plan what this facility needs to look like. We have assistance from state emergency management, as well as the Army National Guard and the state of North Carolina National Guard that will be critical partners in helping us stand up this mass care facility. That's all I have on that right now. We can certainly take questions about that later, but at this time, I'm going to turn it over to Gibby Harris.
As of 2:30 this afternoon, we now have 591 cases of coronavirus, of COVID-19 in Mecklenburg County, and 3 deaths have been reported to date. I want to talk a little bit now about the demographics, and you will be receiving more information about that in a press release after the conference. But I want to point out a couple of things, a little context for you. The results that we use to fill out the map and to give the demographics only reflect laboratory-confirmed cases among county residents. That only gives us a snapshot of the true burden of COVID-19 in our community. There are many who are asymptomatic or who do not meet current CDC recommendations for testing, who aren't being tested and are likely positive. I also want to point out that our daily case count may differ from what you see from the state and the federal government. There are a number of reasons for that. One is that we receive the reports on a rolling basis from those individuals who are doing testing in the community, and we wait until we've had an opportunity to talk to the individuals who are positive to make sure they're county residents and to make sure that we have the best information to provide that data. So again, as you look at our numbers and the state numbers, you will see some differences from time to time. So I want to talk to you briefly about demographics for April 1st. So 2 days ago, we had 466 reported cases at that point. 3 of 4 reported cases were adults between the ages of 20 to 59 years of age. 5 cases were among youth under 20 years of age. The majority of our cases, obviously, are among our younger adults, except for non-Hispanic blacks, for whom 1/3 of the cases were older adults, greater than 60, and only 1/4 were in the youngest age group. At this time, we do not believe the racial ethnic differences observed in our data are related to the spread of COVID-19, or differences in the susceptibility of certain groups to being infected by COVID-19. COVID-19 has no boundaries. Everyone is susceptible. The differences we are seeing are more likely related to the current testing criteria, which is focused on symptomatic individuals, and underlying racial and ethnic disparities in the rates of chronic disease that we see in our community. About 1 in 5 reported cases overall were hospitalized due to their COVID-19 infection. However, hospitalization rates among older adults were significantly higher. 1 in 2 were hospitalized. About 1/3 of reported cases have been released from isolation. These individuals were released from isolation after having met the CDC criteria to no longer be isolated. There were reported cases of COVID-19 throughout our entire community. You will see the maps when they come out this afternoon. Every zip code is affected. We expect these rates to continue to fluctuate as the situation continues to evolve. We are trying to do aggressive marketing to our most vulnerable populations. We are looking to our churches, feeding services, and other services for our elderly population, especially African Americans, to help us get the word out. We are also looking at better communication with our 20 and 30-year-olds in this community. We'll be using social media and influencers to help us with that. Again, I want to say, in the 31 to 2 days we have had in this event so far, we've had 591 cases of COVID-19, and 3 deaths. And again, this only represents a snapshot of the true burden in our community. If you look at the curves, the projections that the manager just shared with you, that gives you a good feeling for what's coming in our community that we need to address. So I want to reinforce the stay-at-home order and the social distancing that we've asked everybody to practice. This will make a huge difference in flattening the curve and enabling our healthcare system to meet the needs of those that are going to need services. I want to thank you all for working on this and being part of the solution, and encourage you as we move into another weekend of nice warm weather to practice your social distancing. Okay, I'd like to invite Captain Graham to come, Chief Graham, to come to the podium and talk to us about emergency management.
Good afternoon. I'm Chief Graham with Charlotte Mecklenburg Emergency Management and the Charlotte Fire Department. Charlotte Mecklenburg Emergency Management is coordinating with partners in the local, state, and federal level, including Mecklenburg County, City of Charlotte, Atrium Health, Novant Health, UNC Charlotte, North Carolina Emergency Management, and the U.S. Army Corps of Engineers in the field hospital planning process. The Charlotte Mecklenburg Emergency Management also coordinates the local incident management team, our IMT, a multi-agency all-hazards response team made up of first responders and other partners who are trained to assist emergency management. The IMT has been supporting the Emergency Operations Center since it was activated on March 16th of this year, and will be supporting hospital administrators on the ground at the site of the field hospital at UNC Charlotte, as well as part of our incident management team that will be on location. This joint planning and implementation process are a tremendous effort, and these partnerships are critical to its success. As part of the EOC operations, there are daily policy group calls held with representation from county, city, fire, law enforcement, EMS, and the healthcare systems to ensure coordination, collaboration in all aspects of this response. This is a 7-day-a-week policy meeting that occurs with all our city and county managers and all the technical aspects that go with that. Additionally, a joint information center has been activated alongside the EOC to coordinate messaging pertaining to COVID-19. Lastly, I want to reiterate what our wonderful health director, Gibby Harris, said earlier. It is important to flatten the curve. And so I want everybody to understand that there are two things that we can do in response to this. One, the building of the additional hospital space at UNC Charlotte, which is important, but at the same time, the flattening of the curve. So if we can flatten the curve, we will be able to get through this with the resources that we have in this county. If we cannot flatten the curve, that creates a huge dilemma for Mecklenburg County and our residents. When you are out in the community this weekend, or whatever you are doing, I want you to think to yourself, could you be at home rather than doing that exercise or event, whatever you're involved with? Riding motorcycles, being on boats, doing all the extra things is not helping us flatten the curve. We need you to stay at home. When you go to the essential services that we have ensured stay open, whether it's grocery stores or big box stores, please focus on essential goods that you need. We do not want you in those stores if you're buying things that are not pertaining to your survival at home. We need to flatten this curve. We're in it together as a community, and it is important that we all do our part in order to do that. Thank you. Next up, we'll have Deputy Chief Estes from the Charlotte Mecklenburg Police Department.
Thank you, Chief Graham. Just a couple of points here. I want to echo, first off, exactly what Chief Graham was talking about as far as enforcement goes and the proclamation and the ordinances. To all those folks, businesses and citizens alike, who from the very beginning understood the severity of the proclamations and the need and the necessity for what we were trying to accomplish as a community and have abided by those, well done. For the rest of you who have not taken it serious, or for those who believe that, what I've seen, they're convincing themselves that the gray areas they may read into the proclamation to allow themselves to do what they know to be non-essential things. Now, if you haven't taken it serious, now is the time. From the CMPD's perspective, Today's cooperation, today's compliance will determine the future restrictions for tomorrow. So the more you comply today, the better the restrictions will be for the future. So we want to make sure that that's done. So far, we've had a good reaction from businesses, but not all. We began to issue citations to businesses who are outside the boundaries of the ordinance. We have ongoing discussions with many of them, including some retailers who want to question if they're supposed to remain open or not. We're working through that with the attorneys. And lastly, we are not immune. Our own CPD family, we've had 2 officers who have tested positive for COVID. We're working very closely with our healthcare leadership in the processes to make sure they're safe and well and that they can get back to work very soon. So with that, I'll turn it back over to our county manager for questions and answers. Thank you.
Thank you, Deputy Chief Estes. We'll start to take questions now.
This is Brett Jensen with WBT News. You talked about the differences between flattening the curve and not flattening the curve in terms of numbers. Why not just go ahead and maybe issue a stay-at-home through May? Because that's when the stay-at-home, that's when the curve would still go through, sort of like what the Virginia government did.
So right now, the order that the county has in place ends on April 16th, and we are going to be looking next week to extend our order to align with the governor's order in terms of time frame. So we will, we've talked to the towns about that, and the managers are, getting their leadership aligned so that we can go ahead and do that. So our order will align with the governor's order. Whether or not we need to extend it beyond that, again, will really be based on the epidemiology we have here on the ground. And if our health director and the other health leadership feels that we need to extend that, then that would be the recommendation that we would make.
Have you determined anything about the field hospital and it's set up at UNC Charlotte? Would actual coronavirus patients be in these dorms that are being cleared, or would separate facilities be built on the campus and the dorms be used for storage?
So I think the question is whether or not there'll be COVID patients that will be housed at UNC Charlotte. These 3,000 beds that we need to bring up are for hospital patients. And so the exact patient type has not been determined yet, but we should anticipate that we will have some COVID-positive patients in those facilities.
I'm Chandler Morgan from WBTV News. Question about the staffing capacity at this projected 3,000 beds for the hospital. How is the county tracking the staffing at the hospitals? Are they going to have to outsource for this?
So again, this is going to be treated like the hospital is bringing up a brand new facility. And we know that across the country, the need for healthcare professionals is a critical need. We're having those conversations with the state as well with the hospital systems as to how we are going to actually go ahead and staff this new mass care facility. It is an issue, it's a concern, and it's something that we're continuing to work through.
Dina, can you talk about the new hospital that will be set up at UNC Charlotte? Exactly what buildings, maybe anything beyond the 6 stories that were referenced, and what steps will be taken to make sure that the facility is safe and return to normal for UNC students?
I don't think I heard the first part of your question, but the second part was, will you ensure it's safe and be returned to use by UNC Charlotte students? And yes, it'll be treated like any other hospital that you have in this community. So it will be secured. There'll be security services there. And when this pandemic is over, those dorms will be restored to their original state, and they will be made available for UNC Charlotte and their students.
Dina, is it only the 6 dorms from WO?
So currently there are 6 dorms that have been vacated by UNC Charlotte students. Those are the dorms that we will be using initially, and then we will continue to evaluate when and where additional capacity will be needed.
So will actual patients be staying in the dorms, or we had read that there were also possibly for like emergency personnel that would stay there, like hospital staff?
No, we're trying to provide hospital bed capacity, and so these beds will be used for hospital patients.
This is Derek with Fox 46. I have a question for CMPD in regards to the gray area. How many people are really kind of trying to exploit this gray area? And I mean, how many visits have you guys had to make in? Also, you mentioned you guys are issuing citations. There was the press release that went out a little bit earlier this afternoon in regards to that massage and day spa that was cited. How many citations have you guys basically sent out?
Yeah, so far, to answer your last question first, so far we've only needed to issue the first citation, but I don't think that's the end of it. I do believe there'll be other businesses who seek to, exploit what's going on and change their modes of operation to now say they're operating as grocery stores or convenience stores because they sell water or chips. So I don't believe this is the last of it, but one so far. You asked me how many people are in the gray area. I don't know a specific number, but I do know that there are those folks out there, both businesses and citizens, who are looking to believe they're exempt when it's been very clear from the very beginning this is a serious worldwide pandemic. If you don't have to be outside to take care of an essential job function or for survival, don't go outside. Doesn't take very far to look to see people who, in my opinion, clearly aren't taking that seriously.
Hey there, Dina. This is Hunter with WCNC. One of my colleagues did a report, of course, after finding some records showing that the county went into crisis mode without notifying the public. Can you explain why that happened?
Sure. We have a crisis management plan that the county uses to manage how we move forward in a crisis situation. And the crisis management plan is really an internal mechanism that we do to allow us to begin our planning. And so on that date, we did trigger our level 2 crisis management situation, did notify the board that we were moving in that direction. And then I believe it was 2 or 3 days later, Gibby made her first press appearance before the public to give us an update on kind of where we were. If you remember, when we went ahead and triggered our crisis 2, our level 2 crisis management situation, we hadn't even had one case here yet in Mecklenburg County. But we were anticipating that we were going to have cases. So that allowed us to elevate our game, start the planning. That allowed us to rent the hotels for the homeless, to bring up child care sites, to be the first in the state to do a stay-at-home order. All of that pre-planning has allowed us to get to the position where we are today, in which we are leading the state in COVID response in the state of North Carolina. So, yeah, we triggered it, and we waited a couple of days to tell the public about that, but that was all part of our planning process.
Ms. Harris, Ms. Rubin from Spectrum News. We've heard some differing information over the past few weeks nationally in terms of whether people should be wearing masks in public. What is your recommendation to people in the county? Should they be wearing masks? And if so, where should they be getting them?
That's a really good question, and we don't have definitive answer around that yet. There have been several high-level individuals who have suggested that it may be useful for everyone to wear a mask. We are expecting some guidance from the CDC later this week or early next week around that. But what I want people to understand that for the most part, wearing a mask is not going to be terribly protective of the individual who is not COVID positive. The masks really serve to keep you from infecting others. It stops the particles that come from your mouth and your nose that can affect others. But for individuals who are in a situation where they are not positive, there may be minimal protection, but that's not the significant use for a mask at this point. And I want to reemphasize what we have been saying from the very beginning of the situation is that it is terribly volatile. Information's changing every minute. We're learning more about this infection and this virus as we move forward. And so it's not, I mean, as you've seen, guidance has been changing almost daily since we started with this. So I would not be surprised if at some point in the near future we understand that masks would be recommended. Now, the bigger question is where people can access those. There are a lot of people who are making cloth masks. And there is some indication that they may be helpful for people who are infected or who may be infectious. So those are things that we're looking at carefully. And again, we're looking to our federal experts to give us some specific guidance on that.
Yeah, I know yesterday.
WBTV. Can we get just a little more information about the 2 officers that tested positive? Was this a situation where they were exposed during work?
The short answer is that we don't know. And as I said earlier, we're working very closely with our healthcare providers and professionals in order to determine that. What I can tell you is that they have been quarantined. Their cleaning initiatives have been taking place to ensure that we do our best to ensure that no further exposure takes place. So we are very cognizant about our employees and our officers' health and well-being. And I can assure you that we take it very seriously. So we don't have an origin for their exposure just yet. What I do have is that a method and means of moving forward to make sure that their health and well-being is taken care of, as well as our other officers and employees.
Deputy Chief, what is your view on hazard pay for your officers? I know other cities have enacted hazard pay. Now we have CMPD officers infected with this. What is CMPD's stance on hazard pay, and will it be something that we would be looking at?
Yeah, there's a couple of points there. One, those decisions are made above me and for differing various reasons. Our officers, I've been a police officer for 28 years. I have seen all of our officers, they do hazardous duty every day. So in that vein, I am proud of the way that we have operated, both as a department, as well as part of our emergency management folks, our medic folks, and all of our first responders and healthcare providers. So I'll leave that decision to those who are above me and smarter than me, but I can tell you right now, I'm proud of the work we've done as a team so far.
Hi, this is Glenn Bergens with Q City Metro. I have a question for Ms. Harris.
Yes, sir.
Yes. Can you tell us more about the marketing effort, the outreach to the Black community, what that involves, and anything else you can give us about the demographics and how this virus might be affecting the different communities differently?
Well, I'll start with the demographics. I mean, as we said, there's a larger percentage of African Americans over the age of 60 that are testing positive versus the younger set, which is the flip side for most of our other populations. We do believe that a good reason, there's several reasons for that. One is the fact that we are testing individuals who are symptomatic and who are having difficulty dealing with this infection. And those are people over the age of 60 and people with underlying health conditions. We know that our African American community, if you look at our statistics, are 3 times more likely than whites to have chronic underlying conditions. So it makes sense that they would be individuals who are more affected by the serious complications of this disease and are more likely to be tested. So we don't think that we don't think that it has anything to do with increased susceptibility at this point. What we're in the process of developing some materials that we'll be getting out through our African American churches, as well as other churches that interact with the elderly, to make sure that that message is getting to them about what they need to do to take care of themselves. And also we're looking at working with our organizations that provide support for the elderly to see what we can do to make sure that those individuals who we've asked to stay home and not come out are getting the services that they need to be able to sustain themselves at home. So those are our efforts at this point. We are wide open to any other suggestions that the community might have in terms of being able to get information out and also ways to support that population.
Quick follow-up. Do you have a time frame for getting those materials out?
Next couple of days is what I'm being told right now.
Thank you.
You're welcome.
Ms. Harris, it's Derek with Fox 46. Question real quick in regards to the stress levels that have been placed on public health and also what you've been seeing from the hospitals. Talk to me about that. I would bet you probably had a chance to speak with doctors, surgeons, nurses, a little bit of everyone over the last couple of weeks. How is it getting at this point?
Well, I think many of us that work in public health and emergency management, law enforcement, and a number of other entities in our community are used to responding to emergency situations. But what typically happens, whether it's a hurricane or an ice storm or a flood, whatever that situation might be, it is usually a fairly short timeline that we have to deal with that situation, and we're in and out. This is, we've talked to all of our staff about the fact that this is a marathon, it's not a sprint. And if you look at the curves that you saw earlier, this will last into another month or two. We are not anywhere close to the end of this, unfortunately. And that day in and day out wear and tear on individuals can be difficult. We're trying to do everything we can to support our staff to make sure that we've got redundancy in the different roles that we all play. That's not always easy. Day in and day out, I'm having conversations with our first responders about individuals or their staff who have been exposed, and the concerns and the issues and the anxiety that they have about the work that they're doing. We know the same exists for all of our healthcare providers who are taking care of individuals in our hospitals every day. And I have staff, limited staff, who is having conversations on a daily basis with those folks who are infected, trying to make sure that they are isolating, that they're taking care of themselves, and that they have the resources they need. So yes, this is very stressful, and it just helps emphasize how difficult as well as how stressful and serious this situation is. It is taxing our system. That does not mean that we're not responding. We're doing the planning that we can do. We're providing the support for all of the folks that are working in this as best we can, but we need everybody's help. I know we've said this several times today. Everybody in this community has a role to play in this. And the better you play your role, the quicker this will be done, and we'll be able to get back to normal.
Ms. Harris, as far as the field hospital goes, I know yesterday you said it's really dependent on if we can get adequate equipment, including PPE, before it opens. I know this is underway now, but with the news that, you know, a recommendation could come for all Americans to wear these when they are out doing those essential things, how concerned are you that this will have an impact for our field hospital being put up?
Well, we're doing everything we can here in Mecklenburg County to make sure that those who are most at risk have the protective equipment they need. So that's our medical providers as well as our first responders. Others who are still interacting with the community because the services they provide are essential, we are trying to make sure that they have surgical masks and the protection that they need. So there's prioritization of the use of that kind of equipment and supplies. That will continue and probably get a little tighter as we move forward. Our hospital systems are looking at ways where they may be able to reuse some equipment and supplies. That's happening across the country as well. And we have a whole section in the Emergency Operations Center who is every day looking through lots of different websites and advertisements and individuals coming forward saying they can provide resources for us and making sure that those resources are what we need. So we're putting as much effort as we can into making sure that everybody has the equipment and supplies they need.
I just want to add one more piece to that around the PPE. I just want to make sure everybody's aware that Mecklenburg County is not immune to the shortages of PPE in vents across the country. And so to Gibby's point, we have people who are working night and day to try to get us what we need, and Chief Graham can talk more about that. But again, we are no different than any other place in the United States of America that is struggling to get sufficient supplies of PPE and vents. And Chief Graham's going to give you a little more on that.
Yeah, so I just stepped out to take a call from Director Mike Sprayberry from North Carolina Emergency Management as we were doing this press conference. We talked about it this morning. We know that there is a shortage nationally, but the state is also in a shortage. They've got requests in to the national level and our manufacturers, and they're doing everything they can in Raleigh to get it from North Carolina. North Carolina, in turn, is doing everything they can to get it specifically for the hot spots in our region, and Charlotte is a hot spot. We have local logistics folks that are assigned to look for any and all personal protective equipment that's out there, and of course our priorities right now are acute patient care practitioners and our first responders that are out on the street. And so we're doing everything we can. Eventually, those supply chain lines will fill back in, but it's going to take some time. And so we're looking at it. We're looking at our burn rates. We're reviewing all of our standards and all our procedures that are out in the field, and we're doing the best job that we can to take care and manage a finite amount of resources that we have currently, and then request those resources through the state and federal government.
Considering that Charlotte is a border city right on the side of South Carolina, and South Carolina is not doing a stay at home, the fact that they just finally this week closed nightclubs and bowling alleys and whatnot, how much of a concern is that for you that they're actually just coming into Mecklenburg County not under a stay at home? And also, how much do you expect their residents to impact the hospitals here in terms of trying to seek care?
Well, I do think one of the challenges that we've experienced is that there are a number of different stay-at-home orders, and they all don't look exactly alike. So what can happen in one county can't happen in another because of the way the order was written. We've been working through those issues as best we can in our county. We're really strongly encouraging individuals in this community not to go to other counties to do things that they can't do here. We need them to obey the order that we have in this community that will help us flatten that curve, as we've talked about earlier. And we also know that our hospital systems serve as regional systems. They don't just care for people in Mecklenburg County. And the curves that you saw that were shared a little bit earlier include the populations from those surrounding counties that our hospitals tend to serve anyway. We need to be prepared for that because we'll never at any point close the borders to tell people they cannot come in for care.
Bother you that South Carolina is not under a statewide state?
Well, that is concerning, but that's a decision that their governor has had to make. And again, we'll continue to work with our community as well as with law enforcement to make sure we're doing what we need to do here in Mecklenburg County.
Gibby, I had a quick question about some of the data behind the patients who are hospitalized. Are you able to share a little bit more about what those patients look like age-wise, race and ethnicity, as well as do you have any data on the amount or the number of people who have recovered from COVID-19 here in Mecklenburg County?
I don't have the specific number. You will see in the data that you get a little bit later this afternoon the percentage of folks that have recovered. I think we're looking at, well, I don't have that in front of me right now, so I don't want to misquote. In terms of hospitalization, I will say that the majority of the individuals that are being hospitalized are over the age of 60 and have chronic conditions. That doesn't mean everyone. We do have younger individuals in our hospital systems who are having serious illness to this disease. So again, this is an infection that does not play favorites. It's an equal opportunity infector. So we need to make sure that everybody's paying attention and doing what they need to do to protect themselves.
You weren't happy last weekend after so many people came to the parks. Obviously, measures were taken this week to try and prevent people going on playgrounds and things like that. But if you see a large number of people at parks this weekend, are there additional measures the county could take, including a curfew?
Dana, do you want to speak to that?
I mean, there are always additional measures that we can take if we continue to see large numbers of people in the parks. We have gone into the parks. We've put up a number of signs in the parks to encourage people to practice social distancing, but we'll monitor it, and if we really feel like it will be beneficial to flatten the curve by closing our parks, it is something we'll consider, but it's not something we'll take lightly because we are encouraging people to get outside, get fresh air, do some exercise. So it's really a balance that we have to strike, but it's something every day is different, as Gibby said, and we'll continue to evaluate the situation and make decisions accordingly.
Ms. DiOrio or Ms. Harris, earlier today the mayor said that a public transportation ban is possible during the surge. Is that something under serious consideration right now?
Did you
essential workers who rely on the bus or late?
So you indicated that the mayor said that the transit system, the transportation system may be shut down. Is that what you asked?
She said that the public transportation may need to shut down during the surge.
Well, I have not heard that. It has not been communicated to me.
So that's not being considered right now?
It's not being considered as part of the planning group that we talk to, that we meet with every single day. That is not something that has been brought up for us to consider.
Dina, it's Allison from The Observer. Can you talk about how the stay-at-home order might have stricter enforcement moving forward, and how 311 is receiving numerous phone calls every day, how those 311 calls are prioritized to enforce social distancing and other gathering guidelines?
So, I mean, I can ask Chief Estie to talk about that. He's really our point person with 311 and how they're managing the complaints that they're receiving.
Thank you. The 311 system is our main way that people can call in to report violations of the proclamation. The way we do that is many times that when they come in, the call takers are able to screen out just a quick question and answer session with the caller to determine what the complaint is or what the misunderstanding is. From there, if the 311 call taker determines it to be a legitimate issue needs to be followed up on, there's forms that are filled out, and then it's routed to the police department, who then further investigates the issues or complaints. Again, a lot of times a phone call or even a visit can handle those. This is not unlike what we do every day for issues prior to the pandemic. So they're prioritized based on what we see the call says, and the variables are too many for me to enumerate here during this conference.
It's Derek with Fox 46. Question from Ms. Diorio. I'm interested in hearing more about the, for lack of better words here, the marketing efforts you guys are doing for the social distancing. You mentioned the use of possible social media influencers, or some are using your social media to get the word out. Tell me a little bit about what that involves. If you guys are using influencers, are you guys using anyone local? Who are you using to actually help get that word out?
Yeah, I'm going to ask Gibby to respond to that. Thanks.
Okay.
Yeah, we have been using influencers through social media with our HIV efforts to reach certain populations, especially younger populations, and we're finding that to be very effective. So we have been in conversation with some of the ones that we're already using, as well as looking at others, to be able to get the message out around social distancing and the need for them to take this as seriously as everybody else in our community. So we're starting to expand that and look at how we better use that resource, because, as I said, in our work around HIV prevention, we found it to be a very useful source of messaging.
Follow up to that. Are we talking about anyone specific celebrity-wise? Are we talking anyone notable community figures? Anything specific to that effect?
I don't have the specific names with me at this point in time. I can work with staff to make that available.
Okay.
The county didn't take any action to address the warming concerns that were brought up last weekend. Or do you have any concerns going forward this weekend about the sandbars?
We spent a lot of time this week talking about the lake and the sandbars, and Duke Energy has been a great partner with us to have regional conversations with all of the localities that have shoreline on Lake Norman specifically, to talk about how we're going to manage activities on the lake. And so far, there's been no consensus to close any of the boat launches, but we do have lake patrol on Lake Norman, as well as Lake Wylie and Mountain Island Lake, to manage those activities on the lake. And so we got feedback from our local law enforcement last weekend, and I think we might have reported that out at one of these news conferences, that they felt they could handle the activity on the lake. The sandbars have been closed, but they can handle the activity on the lake. And so we'll continue to monitor that, and we will work with our other surrounding counties on that. The concern is, if Gaston County closes its boat launches, then people are just going to come to Mecklenburg to launch their boat. And so we really believe it needs to be something that is done with all the municipalities that have shoreline on the lake.
Dina, has there been any outbreaks that have taken place in our nursing homes, or an abundance of cases hitting our nursing homes?
We are monitoring that very closely at this point in time, working with all of the long-term care facilities in our community. We have had one where we've seen at least 3 cases. So we're working with them right now. They're implementing everything they need to protect the rest of that population. But I do anticipate that's a potential concern for the future as well.
We can take one more question if anybody has one.
Dina, going back to Warren Hudson from the Charlotte Business Journal, I have a question for Gibby, please.
Sure.
Just wondering if you could give any more specific updates on testing availability in the county, what those numbers are looking like now, and how you're continuing to make it available to people.
So at this point, our best guesstimate, because we've been working on collecting that data, is during this event, there's been over 1,200 tests done just between the 2 hospital systems and their sites. There are others in the community that are testing that we're not getting information from specifically about tests completed. So we know that we've done about that many. But what I will tell you is that based on CDC and state guidance and the availability of testing at this point and quick turnaround, we are in agreement in Mecklenburg County that we are limiting testing to those individuals who are most at risk, especially those who are inpatient, and it may determine the course of their care, as well as our first responders and our medical providers. So we are continuing through those systems to virtually assess individuals before they're even brought to testing sites for testing at this point in time. We do know that the availability of the quick tests that you've heard about in the news may be coming our way in the next couple of weeks. We don't know how available it will be, how much that will be available to us, and that could change the picture some in what we're able to do in terms of testing. But right now, we continue to be quite limited.
Thank you, everybody.